All right, Kale, I understand that you had what seemed to be some kind of seizure this weekend. Would you mind telling me, in your own words, what you remember from that?
It was morning. I'd been streaming Call of Duty all night. I was pretty hungry, but I wanted to finish my multiplayer game. Then I don't remember anything else. I was in the hospital.
Okay. Kale, had you been drinking alcohol?
Yeah, I like Red Bull and vodka, about 4 of them.
About four. Okay. And now, Mom, can you tell me what you saw?
Well, I was upstairs getting ready for work, just making coffee. Kale was downstairs playing his video games, and I heard it crash. So I ran to the basement door and yelled out for him, and he didn't respond. So I ran downstairs, and he was on the floor, shaking with his eyes rolled back into his head. And I have never seen a seizure before, but I'm pretty sure that this was one of them. I've heard that in these cases you should stick a wallet in his mouth, but I didn't. I just held his head.
Okay. How long did it last? Do you have any sense?
Well, I kept thinking this has got to stop sometime soon, and about 10 minutes later, it was still happening, so I called the ambulance.
Okay. Now, you did the right thing by taking care of his head. That's the most important thing when there's a seizure. Okay, so good job there. So, just to clarify, you've never been diagnosed with epilepsy,
No.
right? And you're not taking any kind of anticonvulsants?
No.
So this may seem like it's a little bit out of the blue, right? If you have no diagnosis of that, to all of a sudden have a seizure. What this is called status epilepticus, when a seizure lasts that long. If it lasts more than 5 minutes, or if the seizures are going on without a break in between, if you have multiple seizures like that, okay? It is fairly rare in your age bracket, much more common in children or older adults, sometimes who have a stroke or something like that, but it still can happen. About 50% of people who experience status epilepticus have never had a seizure in the past. All right, so that's kind of within the norms. Now, but your lack of a prior diagnosis does rule some things out for us. A lot of these types of seizures do come from someone who's on anticonvulsants, but then something changes the effectiveness of that medication. Could be that their dosage just isn't effective anymore. If they add some other medication that has an interaction, if they're using alcohol that affects it by itself, could be developing a resistance to the medication, or even vomiting or something else like that, lowers the dose in their body, and then it triggers the seizure. In this case, when you put together lack of sleep, which could be a factor, with not eating, and then also alcohol, even without the anticonvulsants, all three of those are possible factors for it. So we do have the three of those together. Now, this doesn't mean that you have epilepsy now, okay? You heard that term in the ER, and you told me you're worried about that. Only about 25% of people who have this event happen actually have epilepsy, okay? It's something that we'll test for, and we'll talk to the neurologist about that. It can be also what we call a non-convulsive seizure. You may not notice it happen. It's only seen through brain activity, so they'll review the charts on that, see what they were able to tell. But yeah, the ER will do a couple tests. They'll look for strokes and brain hemorrhages and tumors, just the really important things that we want to rule out that are very dangerous, and then we can look and see about actual epilepsy. All right. But first, we'll start with the physical, and then we'll consult with the neuro.
My name's Megan. I'm a neurologist. We got all your imaging back from the ER, so I'm just going to tell you a little bit about your results and a little bit about what happened earlier. So what you had was called a generalized tonic-clonic seizure. This is what we typically think of when we think of seizures. It's more of like the tonic being the stiffening and the clonic being like the rhythmic jerking, and generalized being affecting both sides of your brain. And so it's kind of a more big, like what we typically think of. Something that you might want to look out for in the future is called a focal seizure. It just affects a certain part of your brain, so it's usually a little more subtle and shorter, and the symptoms are more like just staring or like a strange, funny feeling. So you might just want to be on the lookout for that. As far as your results, we got back an EEG. They were just monitoring your brain activity after the seizure, just in case you had a follow-up one, and just making sure everything was okay there. They did an MRI of your brain. They did not do a CT, mostly because you're young, and really on a CT, all that we expect is a stroke, which is more typical of like an older patient, but you're young, so we're not really expecting that. As far as the MRI, what we were looking out for was Swelling, because your seizure was so long, your metabolic demands of your brain increase, and so we're looking out for something called the T2 signal increase, which would detect the fluid on your brain and cause that swelling. It was normal, so there's no swelling, so nothing to worry about there. And then we were also looking for an ADC value drop, is what it's called. And if it drops, we're more worried about permanent damage. If it doesn't drop, symptoms are likely to just resolve. There was no drop, so we're good. Yeah, everything's pretty normal. So from here on out, we're just going to talk about the best course of treatment.